everyone, welcome back. Thank you for joining me as we begin to cover Chapter 9, which is the blood, lymphatic, and immune systems. Let's get started. Lesson 9.1, Anatomy and Physiology of the Blood, Lymphatic, and Immune Systems. We will begin by recognizing and using terms related to the anatomy and physiology of the blood, lymphatic, and the immune systems. Let's begin by reviewing the functions of the blood, the specialty, and the specialist. The blood, lymphatic, and immune systems are three integrated systems that help the body maintain hemostasis, which is a steady state. The functions of the blood are to provide transportation of gases, like oxygen and carbon dioxide, as well as hormones, nutrients, salts, and cells that defend the body, to regulate the body's fluids and electrolyte balance, acid-base balance, and body temperature. Also to protect the body from infection and to protect the body from loss of blood through the action of clotting. Then we have the specialty, which is hematology. This is the study, diagnosis, and treatment of diseases of the blood and blood-forming organs. The specialist in this field is called a hematologist. Remember, logi is the study of, logis is the one who studies, and hemato is our combining form for blood. Functions of the lymphatic system. So the lymphatic system is responsible for cleaning the cellular environment, returning proteins and tissue fluids to the blood as the means of drainage. Also provides a pathway for absorption of fats and fat-soluble vitamins into the bloodstream, and also by defending the body against disease. Functions of the immune system, specialty and specialist. So the immune system is responsible for defending the body against disease via the immune response. The combining form immuno means safety or protection, and immunology is that study of or diagnosis and treatment of diseases that affect the body's ability to defend itself. The specialist in this field is an immunologist. Hematic system. Hematopoiesis, which is composed of combining form hemato, meaning blood, and poiesis, meaning formation. This is the process of the formation of blood. All blood cells originate from a single type of cell called a stem cell. The liquid portion of the blood is composed of a solid portion that is made up of cells, and a liquid portion called the plasma. The cells make up approximately 45% of the total blood volume, and the plasma makes up the other 55%. Now, these numbers vary slightly depending on an individual's sex, but are important in the measure of a hematocrit, which is a test that we'll be discussing in the diagnostic terms section later. The three types of blood cells are red blood cells that are called erythrocytes, white blood cells called leukocytes, and clotting cells called thrombocytes or platelets. To have an idea of their relative numbers, in a milliliter of blood, there are 4.2 to 5.8 million red blood cells, 5,000 to 9,000 white blood cells, and 250,000 to 400,000 thrombocytes. Blood itself accounts for about 8% of the total body volume, and the average volume of blood is about 10.5 pints or 5 liters. Think of your favorite soda in a 150-pound person. Components of blood. Here we have combining forms hemato and hemo, which both mean blood. Aside from the function of transporting oxygen and carbon dioxide throughout the body, the blood must also carry a protein iron pigment called hemoglobin. Red blood cells are formed in the bone marrow as a result of stimulation by a hormone in the kidneys called erythropoietin. Erythro is our word part for red, and in this term we're meaning red blood cell. Poietin, again, is the forming substance. The life cycle of a red blood cell is about 4 months to 120 days, which decomposes into hemosiderin. Hemo, again, is our combining form for blood. Siderin means iron substance, which is an iron pigment resulting from hemolysis. Remember, lysis is our suffix meaning to break down. Aside from the hemosiderin, bilirubin is also a byproduct of the decomposition. The iron is stored in the liver for recycling, and the bile pigments are excreted by the liver. The morphology of blood cells is important. Remember, morpho means shape. Normal blood cells have a bioconcave, disc-like shape, which moves easily throughout the vessels. In some disorders, such as sickle cell anemia, the shape of the cells is changed, which results in a dysfunction and disease. Let's talk white blood cells. Leukocytes, in general, protect the body from invasions of pathogens. There are two main types of these white blood cells. The first type is a granulocyte. It's called a polymorphonucleocyte. These are named for the small grains within the cytoplasm and the multi-lobed nuclei. Granulo means little grain. So we have polymorphonucleocyte. So poly means many, morpho means shape, nucleo is nucleus, and cyte means cell. These two names are used interchangeably, and you should be familiar with both. There are three types of granulocytes. First, we have an eosinophil. Eosino is our combining form for rosy colored, and phil means attracted or attraction. The eosinophils are cells that absorb a rosy-colored acidic dye, which causes them to have a reddish color. An increase in eosinophils is usually the body's response to defending itself against allergens. Then we have neutrophils. Neutro is our combining form, meaning neutral. These are cells that are neither acidic nor alkaline, and they stain a lavender purplish color. An increase in neutrophils is normal when the body is combating bacteria and pyogenic. Remember, pyo means pus, genic is pertaining to producing. So usually you'll see an increase in these when you have an infection going on. The cells perform the function of phagocytosis. Remember, phago is our combining form for eat or swallow. This is where they consume enemies and remove the debris from the battlefield, so to speak. Then we have basophils. Baso is our combining form for base. These are cells that absorb an alkaline, which is a basic dye, and stain a bluish color. When battling parasites, basophils release both heparin and histamine, which are powerful in healing damaged tissue. Next, we have agranulocytes, which are a second type of leukocyte. Notice that an A has been added in the beginning, denoting an absence of the small grains in the appearance of these cells. They too have another name, mononuclear leukocytes, because their nuclei have only one nucleus. Although these cells originate in bone marrow, they mature only after entering the lymphatic system. There are two types, monocytes and lymphocytes. Monocytes are named for their single large nucleus. These cells are transformed into cells called macrophages. Now, macro is our word part for large. This is a prefix, macro. Then we also have phage. Again, phage means eat or swallow. So the job of a macrophage is to eat pathogens. They are called out for severe infections. Then we have lymphocytes. Lymphocytes are cells that are important in the immune response, meaning that they recognize or remember dangerous foreign substances and manufacture a substance to neutralize them. The foreign substances are termed antigens, and the neutralizing substances are called antibodies. Our next component is a thrombocyte. Thrombocytes are also called platelets. They have a round or oval shape, and the name platelet comes from their appearance as little plates. These cells aid in coagulation, which we know is clotting of the blood, which is the process of changing a liquid to a solid. The process of coagulation begins with agglutination, which is a clumping of the cells. The cells release a substance called factor X, formerly called thrombokinase, which is the presence of calcium, and it reacts with the blood protein to make prothrombin. Prothrombin then forms thrombin. Thrombin converts to a form which is another blood protein called fibrinogen. Fibrinogen is then converted to fibrin, which eventually forms a mesh-like fibrin cloth. Lastly, we have the term hemostasis. Remember, hemo is our combining form for blood. Stasis means stopping or controlling. So hemostasis, or the control of blood flow, is then achieved once that clot is in place. Lastly, we have plasma, which is the liquid portion of blood. This is composed of water, inorganic substances such as calcium, potassium, and sodium. Organic substances such as glucose, amino acids, fats, cholesterols, and hormones. Waste products such as urea, uric acid, ammonia, and creatinine. And plasma proteins, which are serum albumin, serum globulin, and clotting proteins such as fibrogen and prothrombin. Serum is a plasma minus the clotting protein, which we know are fibrogen and prothrombin. Serology is the branch of the laboratory medicine that studies blood serum for evidence of infection by evaluating antigen-antibody reactions in vitro, which is in living tissue. Now let's discuss blood groups. Human blood is divided into 4 major blood groups. They are named A, B, AB, and O. The differences are due to antigens present on the surface of an individual's blood cells. Remember that antigens are substances that produce an immune reaction by their nature of being perceived as a foreign body. Because of this recognition as a foreign body produces substances called antibodies to neutralize the invader in blood, the antigens are called agglutinogens. The antibodies are called agglutinins. Type A blood has A-type antigens. Type B blood has type B antigens. Type AB has type A and type B antigens. And type O has neither A or B antigens. So if a type A individual is transfused with type B blood, the blood will agglutinate because the type B blood is perceived as foreign. However, this type A individual could be transfused with type O blood because it has neither A or B antigens. Type O blood, therefore, is the universal donor because it has no antigens that will cause a reaction in any blood types. Type AB, however, is referred to as the universal recipient because it has both type A and B antigens. Then finally we have the Rh factor. This is another antigen, and it is important in pregnancy because a mother who is Rh negative can develop antibodies to an Rh positive fetus in the first pregnancy and cause hemolysis. Remember, lysis is our suffix meaning destruction of this fetus's blood in subsequent pregnancies. Lymphatic system. The lymphatic system is composed of lymph, also called interstitial fluid, which is the fluid surrounding the cells. Lymph vessels, which are small valvular structures, lymph glands, also called lymph nodes, and lymph organs, which we know as tonsils, adenoids, appendix, spleen, thymus gland, Peyer's patches, and lymphoid tissue. Within this we have monocytes and lymphocytes that pass out of the bloodstream and into the lymphatic tissue through the capillary walls in the spaces between the cells in the body tissue. Monocytes change to macrophages, which destroy pathogens and collect debris from damaged cells. Lymphocytic function will be discussed with the immune system. Lymph moves in one direction, hence the valves in the lymph vessels. In order to prevent pathogens from flowing through the body from the lymph vessels, the flow continues to the lymph glands and onto either the right lymphatic duct or the thoracic duct, both of which empty into the subclavian veins in the neck. Once back in the venous blood, the lymph is recycled through the body for another round. The system filters out the microorganisms as the lymph passes through its various systemic structures. The major lymph glands are the cervical, remember cervico is our combining form for neck, axillary, axillo means armpit, the inguinal, inguino means groin, and the mediastinal nodes. In this background image here, you might notice that you can see some of these lymph nodes, and these are in the cervical region. Immune system. The immune system is composed of organs, tissues, cells, and chemical messengers that interact to protect the body from external invaders and its own internal altered cells. Cytokines, which is made up of cyto, our combining form for cell, and kine meaning movement. These are the chemical messengers that are secreted by cells of the immune system that direct immune cellular interaction. Then we have lymphocytes, which secrete lymphokines, and monocytes and macrophages secrete monokines. Interleukins, remember inter means between and leukin means white substance. These are a type of cytokine that sends messages between leukocytes to direct proactive action. The levels of defense provided by the immune system are divided into a first line of defense, which is a nonspecific immunity, and a second line of defense, which is another type of nonspecific immunity, and a third line of defense, which is a specific type of immunity. The first line of defense includes 3 different methods of warding off pathogens without having to recognize them. First is mechanical. This is the barrier of the intact skin, the sticky mucus on mucous membranes. Second is physical. This is coughing, sneezing, vomiting, or diarrhea. And finally, chemical, whether it be through tears, saliva, or perspiration. The second line of defense comes into play if the pathogens make it past the first line of defense. These include phagocytosis, which is the neutrophils and monocytes, inflammation, which is heat and swelling, redness and pain, pyrexia, which is a fever. Pyro is our combining form for fire. This is our fever. And protective proteins. In that we have interferons, which disrupt viral replication, or complement proteins, which is the inactive forms that are activated in the presence of bacteria to destroy an organism. Then we have natural killer cells. This is a specific type of lymphocyte that acts non-specifically to kill cells infected by certain viruses and cancer cells. Specific immunity means that the immune response is tailored for a particular organism. The antibody formed for the particular antigens are termed immunoglobulins. The recognition of the pathogens can be genetically determined or acquired. If genetically determined, individuals inherit the ability to resist certain diseases because of their species, race, sex, or individual genetics. Acquired forms of immunity are either active or passive. So active acquired immunity is natural immunity. That is the development of memory cells to protect an individual from the second exposure. Because the individuals were exposed to the chickenpox, for example, and then came down with it, they are now then immune to another round. Artificial immunity means vaccinations or immunizations, used a weakened form to enable the body to form antibodies. Then we have passive acquired immunity. We have natural passive immunity, which is the passage of antibodies through the placenta or breast milk. And then we have artificial passive immunity, which is the use of immunoglobulins harvested from a donor who developed immunity against specific antigens. Lesson 9.2, Pathology of the Blood, Lymphatic, and Immune Systems. In this section, we will recognize and use terms related to the pathology of the blood, lymphatic, and immune systems. Terms related to blood dyscrasias. Note that the term dyscrasia is used with only blood disorders. The term anemia is a bit of a misnomer. An, which is our prefix meaning no, not without, and then we have emia, which means blood condition. Remember, emia doesn't mean blood, it doesn't mean condition, it means blood condition. Patients with anemia are not literally without blood, they are just lacking a specific constituent of blood or may be deficient in the normal blood volume. An acute post-hemorrhagic anemia is a red blood cell deficiency caused by blood loss. Chronic blood loss is a long-term internal bleeding that may cause anemia. Sideropenia is a deficiency of iron in the blood. Remember, sidero is our combining form for iron, and penia is our suffix for deficiency. This may be due to chronic blood loss, inadequate iron intake, or unspecified causes. It is a type of an iron deficiency anemia. Then we have pernicious anemia. This is a progressive anemia that results from a lack of intrinsic factor essential for the absorption of vitamin B12. A good way to remember B12 and pernicious is think of the precious BB. Maybe that'll help you remember that pernicious anemia is related to that vitamin B12. So vitamin B12 deficiency is an insufficient blood level of cobalamin, also called vitamin B12, which is necessary for mature red blood cells. It may be caused by inadequate dietary intake or by the absence of intrinsic factor, a substance necessary for B12 absorption. Folate deficiency is an anemia that results from a lack of folate from dietary, drug-induced, congenital, or other causes. Then we have hypervolemia. Volo is our combining form for volume. So this is a deficiency in the volume of circulating blood. Terms related to hemolytic anemias. Aplastic anemia. Note that plasto is our combining form for formation. This is a suppression of bone marrow function leading to a reduction in red blood cell production. Usually it's idiopathic. This often fatal disorder may be caused by hepatitis, radiation, or cytotoxic agents. It is also referred to as hypoplastic anemia. Then we have hemolytic anemias, which are caused by the destruction of red blood cells. If the type is an autoimmune acquired hemolytic anemia, the patient's own immune system is responsible for the destruction of red blood cells. If it is a non-autoimmune acquired hemolytic anemia, it may be drug-induced or caused by an infectious agent. Then we have pancytopenia. Don't get this confused with pancytopenia. This is not a word. It's pan. Pan means all. That's our prefix for all. Cyto means cell, penia is that deficiency. So a way to remember that pan means all, you got to remember when you're cooking, you put it all in the pan. Pancytopenia is a deficiency of all blood cells that is caused by dysfunctional stem cells. Then we have thalassemia, which are a group of inherited disorders of people from Mediterranean, African, and Southeast Asian descent in which the anemia is a result of a decrease in the synthesis of hemoglobin. This results in a decreased production and an increased destruction of red blood cells. Lastly, we have sickle cell anemia. Sickle cell anemia is an inherited anemia characterized by crescent-shaped red blood cells. The change in morphology, remember morpho means shape or form, causes the red blood cell to block the small diameter capillaries, which results in decreased blood supply to the cells. A sickle cell crisis is an acute, painful exacerbation of sickle cell anemia. Approximately 8% of African Americans carry the sickle cell gene, and 1 in 400 are affected with the disease. Sickle cell anemia is expressed only in individuals who inherit the gene from both parents. If only one gene is present, the patient is said to have the sickle cell trait. Terms related to coagulation disorders. Hemophilia is a group of inherited bleeding disorders characterized by a deficiency of one of the factors necessary for coagulation of blood. The suffix philia means a tendency, in this case to bleed. Philia also means attraction to, that's what it means by the tendency. Then we have polycythemia vera, which is a chronic increase in the number of red blood cells and the concentration of hemoglobin. Vera signifies that this is not a sequela of another condition. Sequela means latent effect. Then we have purpura, which is a bleeding disorder that is characterized by hemorrhage into the tissue. Purpura comes from the Latin word for purple. Then we have thrombocytopenia. This is a deficiency of platelets, which are thrombocytes, and this causes the inability of blood to clot. This is the most common cause of bleeding disorders. Terms related to systemic infections of the blood. Septicemia, septo is our combining form for infection, and emia is our suffix again for blood condition. Septicemia is a systemic infection in the blood caused by pathogens that have spread from elsewhere in the body. Then we have septic shock. This is the result of low blood pressure caused by overwhelming infection. Organs fail and death may occur. Lastly, we have systemic inflammatory response syndrome, also known as SIRS. This is a type of septic shock characterized by an inflammatory state affecting the whole body. It may be caused by infection, trauma, ischemia, or inflammations. Terms related to leukocytic disorders. Leukocytosis is an abnormal increase of white blood cells. The suffix cytosis means an abnormal increase of cells. Abnormal increases in each type of granulocyte are termed eosinophilia, basophilia, and neutrophilia. Here, the suffix philia means a slight increase. An abnormal increase of each type of agranulocyte is termed lymphocytosis and monocytosis. Then we have leukopenia, which is an abnormal decrease in white blood cells. Penia is our suffix for deficiency. Specifically, these would be neutropenia, eosinopenia, monocytopenia, and lymphocytopenia. You may see the term written as leukocytopenia. Given the functions of white blood cells, why would a deficiency of white blood cells be a problem? It would be a less protection from pathogens. Terms related to lymphatic disorders. Edema is an abnormal accumulation of fluid in the interstitial spaces of tissues. Edema is one of those terms that can stand alone or act as a suffix meaning swelling. Lymphedema is an accumulation of lymphatic fluid and resultant swelling caused by obstruction, removal, or hypoplasia of lymph vessels. Hypersplenism is an increased function of the spleen, resulting in hemolysis, destruction of the blood cells. Mononucleosis is an increase in the number of mononuclear cells in the blood caused by the Epstein-Barr virus. This can result in splenomegaly. I wanted to go back and make sure you remember that our prefix mono means one, and our suffix megaly in splenomegaly means enlargement. Lymphadenitis is an inflammation of a lymph node. Lymphadeno is our combining form for lymph gland or node. Then we have lymphadenopathy, which is a disease of the lymph nodes or vessels that may be localized or generalized. Lymphangitis is an inflammation of the lymph vessels. Then we have lymphocytopenia, which is the deficiency of lymphocytes. Remember, penia is our suffix for deficiency. Finally, we have lymphocytosis, which is an abnormal increase of lymphocytes. Cytosis is an abnormal increase of cells. Terms related to immune disorders. Acquired immunodeficiency syndrome, also known as AIDS, is caused by the human immunodeficiency virus, which we know as HIV, which is transmitted through body fluids via sexual contact or intravenous exposure. HIV attacks the helper T cells, which causes a diminished immune response. An allergy, also called hypersensitivity, is an immune system's overreaction to irritants that are perceived as antigens. The substance that causes the irritation is termed an allergen. Then we have anaphylaxis, which is an extreme form of allergic response in which the patient suffers severe decreased blood pressure and constriction of airways. The name for this condition comes from the original thought that it was the lack of protection. Ana meaning without, and phylaxis meaning protection, not an overreaction of the body's perceived threat. An immediate allergy is a hypersensitivity caused by immunoglobulin E. Examples are grass and tree pollens. A delayed allergy is caused by activated T cells that respond to an exposure of the skin to a chemical irritant up to 2 days later. An example would be poison ivy, resulting in a rash called contact dermatitis. Terms related to benign neoplasms. We only have one. The only type of benign neoplasm for the blood, lymphatic, and immune system is thymoma. This non-cancerous tumor of the epithelial origin is often associated with myasthenia gravis. Terms related to malignant neoplasms. First, we have acute lymphocytic leukemia, abbreviated ALL, is also termed acute lymphoblastic leukemia. It is characterized by the uncontrolled increase in the number of immature lymphocytes. It is the most common type of leukemia for individuals under the age of 19. Note that lymphocytes are a form of white blood cells. Acute myelogenous leukemia, or AML, is a rapidly progressive form of leukemia that develops from immature bone marrow stem cells. Note that myelo is our combining form in this term, meaning bone marrow. Then we have chronic lymphocytic leukemia, CLL, and it is a slowly progressing form of leukemia in which immature white blood cells proliferate. This form is most frequently seen in middle-aged or older patients and seldom in children. Then we have chronic myelogenous leukemia, CML. It is a slowly growing form of leukemia in which immature bone marrow cells proliferate. Like CLL, it occurs most frequently in middle-aged or older adults and rarely in children. Did you notice that both acute forms grow rapidly while both chronic forms grow slowly? Both chronic forms seldom occur in children. Next, we have Hodgkin's lymphoma, also called Hodgkin's disease. It is a cancer of the lymphatic system that is diagnosed by the detection of a type of cell specific only to this disorder, the Reed-Sternberg cell. Non-Hodgkin lymphoma is a collection of other lymphatic cancers, except for Hodgkin lymphoma. It is the more numerous of the two lymphomas and is the sixth most common type of cancer found in the United States. Multiple myeloma, also called plasma cell dyscrasia or myelomatosis, is a rare malignancy of the plasma cells formed from B lymphocytes. It is called multiple because the tumors are found in many bones. If it occurs in only one bone, the tumor is referred to as a plasmacytoma. A malignant thymoma, also called a thymic carcinoma, is a rare malignancy of the thymus gland that is particularly invasive, and unlike its benign form, it is not associated with autoimmune disorders. Note that the terms related to malignancy do not contain the suffixes carcinoma or sarcoma. Age matters. As you can see here, we have pediatric, which includes hypersensitivities, hemolytic diseases of the newborns, acute lymphocytic leukemia, and then in our geriatric patients, we have hypovolemia, non-Hodgkin lymphoma, and acute myelogenous leukemia. Note that although leukemias occur both in the very young and the elderly, these are different forms. Lesson 9.3, Diagnostic Procedures and Therapeutic Interventions for the Blood, Lymphatic, and Immune Systems. We will recognize and use terms related to the diagnostic procedures and the therapeutic interventions for the blood, lymphatic, and immune systems. Terms related to imaging. A lymphadenography, remember lymphadeno is our combining form for lymph gland or node. This is a radiographic imaging of the lymph gland after injection of a radiopaque substance. It is also called a lymphography. Then we have lymphangiography, which is a radiographic visualization of a part of the lymphatic system after injection of a radiopaque substance. A splenic arteriography is a radiographic imaging of the spleen with the use of contrast medium. Terms related to laboratory tests. Age tests such as the ELISA test and the Western blot test are done to detect the presence of HIV types 1 and 2. Allergy testing is a series of tests involving a patch, scratch, or intradermal injection of an attenuated amount of an allergen to test for hypersensitivity. A basic metabolic panel is a group of blood tests to measure calcium, glucose, electrolytes such as sodium, potassium, chloride, creatinine, and blood urea nitrogen. Blood cultures are blood samples that are submitted to propagate microorganisms that may be present. Cultures may be indicated for bacteremia, remember this is bacteria in the blood, or septicemia, which is an infection in the blood, or to discover other pathogens such as fungi, viruses, or parasites. A complete blood cell count, or CBC, is a set of 12 tests including a RBC, which is a red blood cell count, WBC, which is a white blood cell count, an HB, which is hemoglobin, HC or PCV, which is hematocrit or packed cell volume, and a DIF, which is white blood cell differential. A comprehensive metabolic panel, CMP, is a set of 14 tests that add protein and liver function tests to the BMP. Glucose is also measured by a different method than the basic panel. A Coombs antiglobulin test is a blood test to diagnose hemolytic disease in newborns, HDN. A DIF count is a measure of the number of different types of white blood cells. A erythrocyte sedimentation rate is the measurement of the time it takes for mature red blood cells to settle out of the blood sample after an anticoagulant is added. An increased ESR may indicate an inflammation. Then we have hematocrit, also called packed cell volume, and this is a measure of the percentage of red blood cells in the blood. Hemoglobin is an iron-containing pigment of red blood cells that carries oxygen to tissues. Mean corpuscular hemoglobin is a test to measure the average weight of the hemoglobin per red blood cell. It is used in diagnosing anemia. A mean corpuscular hemoglobin concentration test is done to measure the concentration of hemoglobin in red blood cells. This test is useful for measuring a patient's response to treatment for anemia. A monospot test is done to detect mononucleosis. Prothrombin time is a test that measures the amount of time taken for a clot formation. It is used to determine the cause of unexplained bleeding, to assess the levels of anticoagulation in patients making warfarin or the vitamin K deficiency, and to assess the ability of the liver to synthesize blood clotting proteins. Partial prothrombin time is a test of blood plasma to detect coagulation defects of the intrinsic system. It is used to detect hemophilias. A Schilling's test is a nuclear medicine test to diagnose pernicious anemia and other metabolic disorders. A white blood cell count is the measure of the number of leukocytes in the blood. An increase may indicate the presence of an infection. A decrease may be caused by radiation or chemotherapy. Terms related to blood disorder interventions. The term apheresis means removal either as a suffix or as a standalone term. In regards to blood, it is the temporary removal of blood from a donor, the separation and removal of one or more components, and the reinfusion of the remaining blood back into the donor. Leukapheresis is a removal of white blood cells. Remember, leuko is our combining form for white. Plasmapheresis is the removal of plasma. Plateletpheresis is the removal of platelets, which we also know as thrombocytes. A blood transfusion is an intravenous transfer of blood from a donor to a recipient. If an autologous transfusion, it is a process in which the donor's blood is removed and stored for future use. If an autotransfusion, the process of transferring the patient's own blood from an active bleeding site in case of major surgery or trauma after anticoagulation and filtering. Terms related to bone marrow interventions. A bone marrow transplant is the removal of healthy bone marrow from either the patient or a donor for later transplantation. An autologous transplant, remember auto means self, is when the bone marrow tissue is taken from the patient before treatment to be reintroduced later to form healthy blood cells. A homologous transplant, remember homo means same, is the transplantation of healthy bone marrow from a donor to a recipient to stimulate the formation of new blood cells. Terms related to lymphatic and immune system intervention. An adenoidectomy is the removal of the pharyngeal tonsils, also known as the adenoids. A biopsy of the lymphatic structures is the removal of the lymph nodes or lymphatic tissues as a means of diagnosis and treatment. A lymphadenectomy is the removal of a lymph node, remember the same as a lymph gland? And a splenectomy is the removal of the spleen. Pharmacology, circulatory drugs. Anticoagulants are drugs that prevent or delay the coagulation of blood and the formation of thrombi, which we know are blood clots. Examples include heparin and warfarin. Antiplatelets inhibit the function of platelets or destroy them. Examples include aspirin and Plavix. Blood flow modifiers are drugs that promote blood flow by keeping platelets from clumping during decreased blood viscosity. Examples include prescription medication, Pletol and Trental, and herbal products such as ginkgo biloba. Colony-stimulating factors, CSFs, are agents that stimulate the production of white blood cells in the bone marrow. The two kinds are granulocyte and granulocyte macrophage. Available synthetic agents of each type are filgrastim and sargramostim, respectively. Erythropoietic agents are growth factors that increase the production of red blood cells by stimulating erythropoiesis. Two available agents are eoprotein alpha and darbepoetin alpha. Hematinics are drugs that increase the number of erythrocytes and/or hemoglobin concentration in the erythrocytes, usually to treat iron deficiency anemia. Examples are iron supplements and B-complex vitamins. Hematopoietic agents are agents that stimulate blood cell production. Subdivisions of this class include colony-stimulating factors, erythropoietic agents, and thrombopoietic agents. Hemostatics are drugs that help stop the flow of blood. Remember, static means stopping or controlling the flow of blood. Examples include Amicar and encyclocapron. Thrombopoietic factors are agents that stimulate the production of thrombocytes or platelets. Alprelvicin or Numega is an available agent. Pharmacology of the lymphatic and immune drugs. Antihistamines are drugs that block histamine receptors to manage allergy symptoms. Examples include Benadryl and Claritin and Allegra. Anti-immunoglobulin E agents are monoclonal antibodies used to treat allergic asthma and allergic rhinitis. Xolair is the first available agent in this class. Anti-neoplastics are drugs that are used to treat cancer by preventing the growth or promoting the destruction of neoplastic, also known as tumor cells. Numerous drugs, including methotrexate and rituximab, fall into this category. Antiretrovirals are drugs that manage the replication of HIV and its progression into AIDS. Examples include Retrovir and Sustiva. Corticosteroids, also known as steroids, are drugs that suppress the immune system and reduce inflammation. Examples include cortisone and deltazone. Cytotoxic agents are drugs used as immunosuppressants or anti-neoplastics in order to damage or destroy cells. Immunosuppressants are drugs that reduce the immune response. Examples include Imuran and Cytozan. Leukotriene receptor antagonists are drugs that block leukotrienes to manage later stages of allergic reactions. They are used in particular to manage allergic asthma. The two agents in this class are Singulair and Accolate. Protease inhibitors are antiretroviral drugs used to treat HIV infections. By blocking the production of an essential enzyme called protease, these drugs keep the virus from replicating. Examples include Varicept and Invarase. Vaccines are substances administered to induce immunity or reduce the pathologic effects of a disease. Examples include measles, mumps, rubella vaccine, and the chickenpox vaccine. All right, everyone, that's all I have for you today. Thank you so much for joining me.